Okay, so we've got this really interesting situation in front of us today for our deep dive.
Yeah, looks like we're diving into a case of a 57-year-old guy.
Yeah, he's got type 2 diabetes.
Mm-hmm.
And now he's been diagnosed with hyperlipidemia, too.
Oh, wow.
And his doctor just put him on a new medication.
Okay, so what are we thinking? What's the goal for today's deep dive then?
I think what we need to figure out is why the doctor chose this specific medication for him.
Right, makes sense. So we got to figure out how this drug actually works,
Yeah.
inside his body.
Exactly. And what he needs to know to manage this whole situation safely and effectively.
Like, what's the really important advice that he absolutely has to follow? The kind of stuff that can make a real difference.
Yeah, exactly. And all of that focusing on how to manage his cholesterol and triglycerides in a smart way.
Gotcha. So we're talking practical stuff here.
Practical implications for this guy.
Right, I like it. Let's get into it.
So the new medication is niacin.
Niacin, okay.
And apparently it helps lower how much triglycerides his liver makes.
Okay, so it's working right at the source.
Right, and it's supposed to cut down on the release of VLDL and LDL.
Which is huge for someone with hyperlipidemia, of course.
Absolutely. And he already has the type 2 diabetes.
Where managing those lipids is super important.
Really important.
Yeah. So niacin, it seems like a good fit so far.
Yeah.
But how does it actually do all that? What's the mechanism?
Well, it has to do with this enzyme called diacylglycerol acetyltransferase 2.
Diacylglycerol acetyltransferase 2.
Yeah.
Wow, that's a mouthful.
Yeah. And niacin basically inhibits it.
So it's like putting the brakes on the liver's fat production line.
Exactly. And that's especially important for someone with type 2 diabetes because they often have high triglycerides.
And those smaller, denser LDL particles.
Right, which both increase the risk of heart disease.
So niacin's going right at those risk factors.
Right. And now let's talk about side effects because that's something he's probably going to experience.
Oh, yeah, for sure. Especially with niacin.
Like itching and flushing.
Ugh.
Yeah.
Yeah, that's the prostaglandins.
Right. And this attending tip we have says to take aspirin before taking the niacin.
Wait, really? Beforehand?
Yeah, to reduce those side effects.
That's interesting. I wouldn't have thought of that.
Yeah, it's because aspirin can help lower the production of those prostaglandins.
Which cause the itching and flushing.
Exactly. So it's like a preemptive strike.
Makes sense. And what about ibuprofen? Is that an option too?
Yeah, they mention ibuprofen as an alternative.
Good to know. And are there any other tips for dealing with those side effects?
Well, taking niacin with food might help.
Okay, yeah, it's easy enough.
And there's also a prolonged release version.
So fewer spikes and hopefully fewer side effects.
Exactly. Now we should probably address some of the misconceptions surrounding niacin.
Yeah, people always seem to have the wrong idea about certain medications.
Like some people think you need to get your creatine kinase levels checked.
Oh, right, the CK levels.
Yeah, but that's not really necessary unless you have symptoms.
Especially since he's probably already on a statin.
And those together can sometimes cause muscle problems.
But monitoring CK levels is really only for when someone has noticeable muscle pain or weakness.
Not just routine checks.
Right.
Another misconception is that you can take diphenhydramine for the skin rash.
Like Benadryl.
Yeah, but that's for allergies.
Right. It blocks histamine.
And niacin skin effects are caused by those prostaglandins again.
Not histamine. So diphenhydramine wouldn't really do much.
Nope. So what about the idea that you should avoid smoking because of niacin?
That's another one that's not quite right.
Yeah, because niacin itself doesn't increase the risk of blood clots.
Obviously, quitting smoking is always good for your heart.
For so many reasons.
But it's not specifically because of the niacin.
Right. And the last misconception is about checking blood sugar for hypoglycemia after taking niacin.
I've heard that one too. But isn't it the opposite?
It is. Niacin actually increases blood glucose.
So it's hyperglycemia, not hypoglycemia.
Exactly. So no need to check right after taking it.
Gotcha. So many myths out there.
So to sum it all up,
Yeah.
for you, the biggest takeaway is understanding how niacin works.
To manage triglycerides and LDL.
And remembering to take that aspirin beforehand.
To minimize those side effects.
Exactly. The itching and flushing.
It's all about being proactive.
Right. Making informed decisions.
And taking steps to make the treatment as comfortable as possible.
So you can stick with it and see the benefits.
Absolutely.
Right.
That's what it's all about.
Well, this has been a fascinating deep dive.
Yeah, we covered a lot of ground.
And it just goes to show how interconnected diabetes and hyperlipidemia can be.
And how important it is to understand the medications you're taking.
And how they might interact with each other.
And with your lifestyle.
Exactly. So here's something to think about. As you navigate these conditions,
what other seemingly small changes
could have a big impact on your overall health?
It's definitely something to consider.
Food for thought.
Definitely. Thanks for listening, everyone.
And thanks for diving deep with us.